Hello, and thank you for watching this short video to help prepare you for your cardiac surgery experience here at John Muir Health. I am Dr. Ramesh Veeragandam, Co-Director of Cardiac Surgery. Our Cardiovascular Institute is led by a dedicated care team focused on listening to your needs, explaining each step of treatment, and working together with you to ensure you receive highest quality care.
Prior to your surgery, the cardiac surgeon will review instructions related to your procedure in an effort to ensure all your questions or concerns are addressed. During this process, the surgeon will discuss your health history and review some important precautions. Certain medications may need to be avoided before surgery. If you are on blood thinners such as aspirin, Plavix, Lovenox, Eliquis, Effient, Brilinta, Xarelto, or Coumadin, your doctor will discuss with you whether you should continue or stop any of these medications before surgery. We will tell you when it's safe to restart. If you smoke or drink alcohol, it is important to quit 1 to 2 weeks before your surgery. This will decrease your risk of complications. You will be scheduled for a pre-admit appointment where testing will be completed and education will be provided by our cardiac nurse navigators. This appointment will be located at Concord Medical Center in the Cardiovascular Institute. Concord Medical Center is located at 2540 East Street in Concord. Please bring your insurance card, photo ID, list of current medications, and a friend or family member who will be involved in your recovery. During your appointment, your nurse will inform you what time to arrive at the hospital and what medications you will take the day of your surgery. Your nurse navigator will provide you with an incentive spirometer and explain its use at this appointment. Please do not eat or drink anything after midnight the night before your surgery. On the day of your surgery, please leave your valuables at home, but do bring your photo ID, incentive spirometer, and a complete list of your current medications. Enter through the main entrance of the hospital and check in with security. You will then proceed to the short stay unit, where you will be admitted and prepped for surgery. Your family is welcome to accompany you to the short stay unit and remain with you until you are taken to surgery. During surgery, your family should wait in the Cardiovascular Institute lobby. An operating room nurse will contact your family with periodic updates while you are in surgery. The surgeon will meet your family in the lobby when surgery is completed. Approximately an hour after the surgeon updates your family, they can proceed to the Cardiovascular Intensive Care Unit, or CVICU, to visit you. The CVICU is located in the E Tower of the Cardiovascular Institute on the second floor. Your visitors will need to pick up the beige phone located outside the double doors to gain entrance into the CVICU. Hospital visiting hours are from 9 a.m. to 9 p.m. The CVICU allows 2 visitors at a time. At John Muir Health, visitors are welcome as they can be a patient's best medicine. However, during the first 48 hours following your surgery, visitors should be limited to family and close friends. We are working on reducing noise in the environment to help you heal and be as comfortable as possible. Please help us by advising visitors and family to make every effort to reduce noise, and inform us if you become aware of noise distraction in the area you are staying. Following your surgery, you should expect to stay in the CVICU 1 to 2 days for close monitoring in a private room by a dedicated care team. During your stay in the CVICU, several healthcare professionals may enter your room throughout the day and night to check on you and help you through your healing process. We encourage you to ask them questions if you are uncertain about their role in your care. If you are not already provided one, don't forget to ask for a quiet kit to help you get the rest you need and lessen the noise around you. Pain management is an extremely important part of the healing process. Properly managing your pain speeds up this process, allowing you to become more active. Please let your nurse know if you are having pain after surgery by pressing the red button on your call light. We have several methods of pain management for your comfort, and your doctor will help choose the most appropriate method for you. As you get closer to leaving the hospital, we will transition you to oral pain medication. Because pain medication can cause constipation, we provide you with stool softeners and laxatives after surgery. Please let your nurse know if you have trouble with bowel movements or if you have loose stools. You will use an incentive spirometer 10 times per hour while you are awake. This is a plastic handheld breathing device that helps you practice your deep breaths. Coughing and deep breathing are very important following cardiac surgery in order to decrease the risk of getting pneumonia. The day after your surgery, we will start you on a liquid diet such as juice and Jell-O. We will advance your diet to regular food as you tolerate it. Typically, the day following your surgery, our staff will help you sit up in a chair and possibly take a few steps. Our physical therapists and our occupational therapists will be working with you on a daily basis to help you increase your strength and endurance. Please do not attempt to get out of bed on your own. Always use your call light for assistance to avoid falling. As you continue to recover, you will move from the CVICU to our Cardiovascular Progressive Care Unit, or CVPCU, where you will remain until you leave the hospital. The PCU is also located on the second floor of the Cardiovascular Institute. During surgery, chest tubes will be placed to drain air and fluid. Typically, these are removed several days after surgery. You will also have a urinary catheter that will come out a few days after surgery. Your follow-up appointments will be scheduled in advance and printed on your discharge instructions. Please reschedule them if needed. Your case manager will assist with the discharge process. If you require additional supplies at discharge, such as a walker, your case manager will work with your insurance provider to make arrangements. We will provide you with home care instructions. Some of these include checking your weight every day, continued use of your incentive spirometer, walking at least 4 to 5 times per day, and keeping your legs elevated while sitting. Be prepared to leave the hospital 4 to 5 days following the day of your surgery. You may go home sooner or later, depending on your healing process. Your nurse will review discharge instructions with you and your family or caregiver. We recommend you have one of them present during this time. You will need help at home for at least the first week. Under certain circumstances, some patients may require extra care in a skilled nursing facility after leaving the hospital. If this is the case for you, we will discuss this with you during your stay and provide you with medical transportation to the skilled nursing facility. We recommend you include a family member or caregiver to assist you in the recovery process. In addition, most insurance carriers will cover home health services such as nursing and physical therapy when you are discharged home. John Muir Health will send most new prescriptions electronically to your pharmacy of choice at discharge. Please have someone pick up all your prescriptions the day of discharge so you have all your necessary medications. Although we don't expect it, if you experience any of the following symptoms after leaving the hospital, please report them to your cardiac surgeon. Severe persistent pain not relieved by medication and rest. Increased redness, swelling, or drainage from your incision. Temperature over 101 degrees Fahrenheit. Please call your cardiologist if you experience any of the following symptoms: fast, slow, or irregular heart rate, unusual shortness of breath or dizziness, weight gain of more than 3 pounds in a day or 5 pounds in a week. It's extremely important to know if weight gain has occurred. Chest pain that is not from your chest incision. If you have a non-urgent question or concern, you can reach the cardiac nurse navigators Monday through Friday from 8:30 a.m. to 5 p.m. at 925-674-2569. Remember, caregivers will also need support during this process. Don't be afraid to reach out to friends and family for help.
We understand surgery can be stressful for you and your loved ones. Please be rest assured that we will do everything we can to make your surgical experience as comfortable as possible. We hope this video has provided valuable insight for you and your family. Remember that at John Muir Health, we listen, explain, and work together as a team to help care for you. Thank you for watching, and thank you for choosing John Muir Health.